Sandra. We're just adjusting some camera at the moment for those of you online. That's great. Okay, so welcome to everybody who's joining us online this morning and to everybody in the room. You're probably aware the morning plenary ran over slightly, so apologies if people are entering the room after they've queued for a coffee machine, and I hope you've managed to grab a drink if you're at home or at work dialing into the session. So my name's Claire Maven. I'm one of the portfolio leads at Healthcare Improvement Scotland, and I'm delighted to lead not only the acute adult programme but also the paediatric programme, which is launching today, the perinatal programme, which is going to launch in November, and the acute frailty aspect of the Focus and Frailty programme. And today I'm going to be your chair for this session. And a little bit of, I suppose, background to how this session came around before we get to a bit of housekeeping. And I guess, you know, we spoke a lot this morning about the pandemic and the challenges in the system, but what became more clear to us as we've met with boards and teams and boards is that there are a number of people who were not involved in SPSP from the inception, and indeed probably haven't been grounded in that quality improvement methods. And we've had an ask from teams that for everything that we're kind of doing moving forward, is it possible to put some kind of quality improvement education / training / understanding of how we embed the work that we have within the learning session? So we're planning moving forward to try to offer that as part of all of our offers of our programmes. And so today we're doing a wee bit around the essentials of safe care in order to sort of get that message across. So a wee bit of troubleshooting. You'll probably know by now that if you're having any problems, you can get in touch with us using the email or using the WebEdge chat. If you could switch your camera off and your microphone off, that would be great. But the chat room is open, and we've got people manning that in the room if I miss it. But if not, just put your camera on and jump up and down, and somebody will see you. Will not be bothered. A bit of in-person housekeeping. We're still expecting the fire alarm in the room, so it is a test, so you don't have to do anything, so don't worry if that goes off. Reiterating the message around the paediatric session, if you're online or you're in the room, just smartly go and get a bit of lunch, because that session starts at 1:30. Okay, so we're just going to start with a bit of who is actually at the session. So if you're online, I was just going to ask you to put your name and the board or partnership that you're working in and the role that you're in, so we've got an idea of what the audience is like. And I suppose in the room, maybe just speak to the person next to you, introduce yourself, say what your background is, and we'll just give a couple of minutes to do that. Okay, so I'm going to keep it short and sweet so we can get back to lunch. So great to see some people online from a number of different boards, and hopefully in the room. Hopefully in the room you've had a chance to introduce yourself to the person next to you or at the next table. So without further ado, I'm delighted to introduce two members of my team. First, I think it's going to be Megan, who's a Senior Improvement Advisor supporting the acute work and the frailty work. and then followed by Scott, who's an improvement advisor in the team who's supporting the focus and frailty work. So I'm going to hand over.
Okay, so we're going to do a wee bit of Slido work first, both for online and in the room. So we're going to get you to use, there's a QR code on the tables in here. And Jamie, for online?
Just posted a link.
Just posted a link online. Brilliant, thanks so much. So the first thing we're going to look at is previous experience of QI. So just to get a sense of your previous experience of QI. So we'll just give that a wee second to load up. Brilliant, so we're seeing quite a range already. So a bit of a difference between half of us having completed a formal QI course, about a quarter completely new to QI, completed online modules. Oh, this is changing all the time. And being part of a team. So it's sort of moving about. So that we've got a reasonable proportion of people who have completed a formal QI course, and it's really great to have those people in the room, but as well as people who are completely new to QI, because I think the thing with the PDSA work that we're going to concentrate on today is that thing about if you're not using it all the time, it's quite easy to get out of the way a bit or to lose your confidence a wee bit. And that this will just give us a wee opportunity to go back through some of the key points of that today. So on a scale of 1 to 10, how confident would you be, or are you, in trying a change using a PDSA cycle in your workplace at the minute? So 1 is not confident, 10 is very confident. Got quite a mix, haven't we? So that's going to be really good, and we're going to look at that again towards the end of the session so you can see where you're at, how you're feeling, and where you might still have questions or things that you want to follow up on after this session this morning. So we're going to start very briefly around what is quality improvement. So quality improvement can be defined as the application of systematic approaches that use specific techniques to improve quality. And that means that we're going to apply a method, and that's how we can take it step by step and see our improvements. And that is supported for us through the next quality improvement journey. So we have creating the conditions, so that's developing your will and your guiding coalition, into understanding your system. So before we do that natural thing of like, I want to fix this bit, you want to go and actually, do I really understand what's happening here? What else do I need to find out? Who else do I need to speak to? Before you then move into developing your aims, testing changes, and moving on. And surrounding all of that is the importance of leadership and teams within that, and you'll hear more about that as we go through today. Project management and communication cannot be underestimated in that. If we don't have that, it will fall. And measurement, because if we don't know what our data is telling us, whether that's qualitative data from speaking to people and speaking to patients and families and carers, or whether that's quantitative data through numbers to understand what's happening in our system and whether the things that we're doing are making the difference that we intended. So today we're going to talk about developing aims and testing changes mostly, and a wee bit in understanding your system. So this will be familiar to a lot of you. This is the model for improvement, which is one of the approaches to looking at QI. And what we're looking at that first top box are those 3 questions. So what are we trying to accomplish? Or what is our aim? How will we know that change is an improvement? So that's your measures. And what change can we make that will result in improvement? And that is your tests. But before you do all of that, you need to do your understanding your system. So whether that's getting baseline data to understand what's happening, whether that is speaking to people, whether that's doing other QI tools. And if you've been on a QI course, you'll have had access to them. My advice would be, if you haven't done them for a while, don't worry. It's always about useful data, not perfect data, and it's about engaging with other people and not doing it in a room by yourself. You want to kind of get that whole look at what's happening in your system. So you start with that idea or that hunch about what's going on, and then you move into that developing your aims, thinking about your measures, and then having that brain dump of things that you want to have a go at that you think might make an improvement, ideally based in the evidence. And then once you've got those list of ideas and you've prioritised them, then we move into what's known as the PDSA cycle, which is plan, do, study, act, and we're going to focus on that predominantly today. So we go from that thinking bit in the 3 questions at the top into the doing bit, which is the testing at the bottom. But that's not to say that in the thinking bit, that's by yourself. Absolutely do it together. Don't do it alone. And as Scott always says to me, if you don't answer those 3 fundamental questions at the top, you're at high risk of failure, because you'll just jump into the trying, and actually not be able to track your improvement or know where you're going. So it's that thing about, is my ladder up against the right wall that I'm going up it for my testing, or have I got it in the wrong wall? And that's where your aim will really help you, your measures will help you, and then having those list of changes. Because the PDSA does that thing about small scale tests of change. It's low stakes. It means you can adopt, adapt, abandon the things that you test. It doesn't need to be perfect first time, and you can learn from it so that as you test, you change your ideas. So the first one around what are we trying to accomplish? So this is about your aim. So John Berwick talks about some is not a number, soon is not a time, and hope is not a plan. And that's always the way that I look at my aim statements, is like, it's actually sort of narrowing you down to where is the scope of this? How big a project is this? And then usually slashing it down a bit further and focusing it down a bit further. Because we have a tendency to start quite large. And the devil in the detail of a good aim statement is something that provides you a framework that you can come back to, that when somebody says, oh, well, we could just add this extra bit, then you can take them back to the aim statement that you've agreed as a team and say, actually, that's sort of out with the scope of this. This is the framework that we are using. This is what's included and excluded in that. And it brings you back to your focus and to understand your scale. So it might be that you want to reduce the number of pressure ulcers in Ward 5. You know, it might be as specific as that. It doesn't need to be about the whole hospital. It doesn't need to be about the whole specialty. It can be really specific, and the aim statement can really help you then keep the boundaries around that. Team membership is really important, particularly in understanding your system and thinking about all the people who might touch a part of that process being involved from the beginning. Not only because you generate better will, because you don't exclude people from the outset, but also because you generate better ideas. You see things from multiple perspectives. And when you're then getting your list of changes to test, your ideas of things to test, you get a richer bank, and you get them sort of debated better so that you can narrow them down to have a better impact for what you're trying to aim to do. And within the aim statement, the benefit of having a really good aim statement is that when you're then communicating what you're doing, whether that's with a person that you're hoping to test your change idea with, or whether it's sharing the impact, you have something really clear to come back to that's got that how much, by when, and where, and is really specific. So in the essentials of safe care, we have person-centred care, we have safe communication, we have leadership to promote cultural safety, and we have safe and consistent clinical and care processes. And the idea behind having this driver diagram to support the aim, which is to enable the delivery of safe care for every person in every system every time, is to sort of encompass that overarching thing of, if we don't have these building blocks, we won't be able to deliver safe care, regardless of whether if we're wanting to reduce pressure ulcers, for example. If we don't have safe communication, if we don't have person-centred care, if we don't have leadership and culture, or we don't have a safe clinical and care, we won't achieve our aim. So the essentials of safe care are always a good place to come back to when you're developing your aim statement and thinking about what you're wanting to do. Think, actually, have we thought about how these things fit in? Because if we don't have these, then we're probably going to get tripped up quite quickly. So when you take from your primary drivers, which is if we add all these things together, can we be confident if we achieve them that we'll achieve our aim? And then you can work backwards then into the secondary drivers, which are the things that contribute to these. It sort of goes back and back and back, down and down and down, like 5 whys. So we're saying that for leadership to promote culture of safety, if we have psychological safety, we have staff wellbeing, and we have a learning system, we should have leadership to promote culture of safety at all levels. And when you get back then underneath the secondary drivers, that's where you go, okay, so my project is going to focus on psychological safety to improve leadership to get us here. So I need to change ideas which will be affected by that, so that will contribute to improving psychological safety. So then in your change package, which is available online, there's a range of change ideas. Now these are not exhaustive, but they start to give you a bit of they're a starter for 10, for you to think about what things do I think in my context, in my setting, could improve the secondary driver that could then contribute towards the primary driver, contribute towards our aim. So for a minute, we're going to take a pause and identify a change idea. You can either choose one of the ones that's down the right-hand side, or something for your context that feels good for something that would support the secondary drivers, and just note it on a post-it note and keep it for later, and have a chat with the person next to you. And for the folk online, if you can keep a wee note of it and also just pop it in the chat. So what change idea might you like to test that would help with safe staffing and safety huddles, or use of standardised tools for communication, so for example SBAR, or for improving staff wellbeing through celebrating success? I'll give you a wee minute, have a wee think. Doesn't need to be perfect. If there's something that you think, actually that's annoying me, and we could maybe have a wee try. Mark that, we're going to come back to that in a wee while. We then think about moving into our measures. So how we'll know that a change is an improvement. We're not going to spend lots of time on this, because we're going to spend the predominance of our time talking about PDSAs, but it's really important that we think about data, because there's some good evidence that shows that when we use PDSAs, quite often we don't actually do measurement that sits alongside them. So we sort of iterate based on our gut and our learning, but we don't actually track the data. So again, it's useful data, not perfect data, but having a think. So what things from the work that you've done previously, or from your own clinical or care context or improvement context, what does data help you with? I'll just open up the room into the chat box. Yeah.
I mean, personally, in the NHS personnel, we use data to see if a change we've made is actually making improvements.
Yep.
So, like for instance, our collaborative with the falls, if we make a change on one of our test boards, we'll use our data that we collect monthly to see if that change has made a difference, or if it's actually makes the situation worse. So that's how we use data.
So it gives you that intelligence back.
Yeah.
It's something that's a wee bit concrete on top of that experience data.
I suppose just kind of confirm clinical reasoning, so things will be able to be used kind of observation schemes that then will back up judgments.
So sort of triangulating your data, having multiple things that are contributing to telling you what a picture. Yeah. So some of the things are, so understanding what needs improved, so that's sitting in that understanding your system bit about, I think there's something going on here, but I don't know what it looks like, so let's get some data and see what it looks like. To understand variation, so that's how is it different Monday to Friday compared to the weekend? How is it different overnight compared to through the week? How is it from ward to ward, hospital to hospital, care setting to care setting, board to board? And what does that tell us? It's not about judgment ever in terms of variation, it's about just understanding what's happening. For testing changes, just exactly as you're talking about, so what is the impact of that? For monitoring your progress of that, and also to tell that story. So the data is really persuasive on top of and with that experience data of this works really well for us because bam, 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 bam. And then you've got your false data that sits alongside that to say, actually that did have the impact that we thought, or we think it feels better, but we're not seeing an impact in our data yet, because you sometimes see a bit of a lag between making a change that is working for you and the data itself. So we're going to take us into, so thinking about a change you've tried in the past, and it could be in your professional life or in your personal life. What could you have measured, or did you measure, that told you whether or not an improvement had been made? And if you didn't have a measure at that time, is there something else that you could have done to measure that would have given you that information? So thinking of a change that you've tried in the past, and have a chat in your group. And online, if you would like to pop it in the chat, that would be brilliant. Yeah, and Annette, absolutely, data helps with identifying a need for change. Okay, so we're going to bring that conversation to close, and we'll be going to pick that up again in a wee while. So we're going to move on now to what changes we can make that will result in improvement. So Scott, I'm going to hand over to you.
Very much, mate.
You're welcome.
Hello to our online audience and hello to the room. Talk to some of you already. So this is where we're going to get really into focusing on developing aims, having that clarity about what we're trying to achieve, and starting to do the bit that we all enjoy, which is the testing of the changes and PDSA. So in the room and online, if you just want to chuck some stuff in the chat as well, what's your experience of PDSA? How many of you have been involved in using PDSA, maybe to facilitate a change in your role? A couple of nods in the room. Online, MD, want to pop their hand up, or sorry, pop in the chat? Yeah, so Lisa's saying, yeah, we've used PDSA. A lot of folk think that they know PDSA and they like to jump in. And that's great, because in the clinical setting, we're all really positive, enthusiastic people, and we want to do. But what a lot of people do is they overlook the P part, which is the plan. So in quality improvement, we talk a lot about plan to fail to plan to fail, which there's a wee bit of paradox in QI methodology, because we talk about a fail being a first attempt at learning. And just to clarify that, what we're not talking about is the test itself. It's sometimes not a bad thing for a test to fail, because you get learning out of that. But if you've planned a test properly, what you're going to do is maximise your learning. And if you've not done the proper planning, then you might miss something. You might have made assumptions that further down the line, as you get to testing, won't come up, but they'll come back and haunt you at a later date. So fail to plan to fail, not for the test itself, because any testing is great because you're learning, but what we want to do with our PDSA methodology is maximise the learning that we get from the first tilt at testing a change. Does that make sense? And so coming back to the 3 questions relating to PDSA, again, one of the misconceptions a lot of people do is they don't think about the 3 questions. They just want to get into plan, do, study, act, and they forget how important, how fundamentally threaded throughout this process that they are. So if you look in the plan section, have a clear objective. That's bringing you right back to your aim. What are we trying to accomplish? What are we trying to achieve? Do we have clarity in that? And Megan highlighted to you earlier on about keeping that quite tight and quite focused, and not having lots of caveats to things, keeps it on track and keeps it focused. It's also about that change. What predictions, what do you think is going to happen? What do you expect to see when you implement your change? It's really important to understand that we expect to see X if we do Y. Okay, and plan to carry it out. Who's involved? When is that? How are we going to do it? Where is that? All these contextual factors are really, really important. And probably the biggest one in there is the who. And we were talking about it in our little table at the top there, that if you've not got everybody on board, sometimes that can cause your test to unravel and you get the unintended consequences, or you get consequences or outcomes that you weren't expecting when you made your prediction. So the plan is actually really important. And if you spend a little bit of time, it's probably the same as a lot of things in life. See, if you spend a little bit of time thinking it out at the start, you actually get better execution coming out at the end. So fail to plan to fail. Measurement's also put into this. So how are we going to know that our changes are an improvement? So that links into that predictions, and that links back to your aim. So 3 questions are still threaded through this PDSA cycle. How are we going to know that our changes are an improvement? Analysing that data in the study part of it, how did that compare to what we thought was going to happen? Did the data come out the way we expected it to? If it didn't, why didn't it? And then use that learning, that knowledge to summarise, okay, I understand how that test went. I've now got decisions to make when you move into the ACT part, which Megan highlighted earlier on about, do we need to completely abandon the test because it was a complete car crash and it was doing more harm than good, or it was totally off the rails, but there's something in it. Maybe we need to adapt it to suit our context. Or have we cracked it? Have we actually got to the end? We've got a test that works, we've shown in practice, we've tested that it works, and we're going to adopt it. Now, interestingly, we did the poll at the start about people's experience of quality improvement. Believe it or not, in this room, we are all quality improvers. Did you know that? And online, you're also quality improvers too. So we do it all the time in real life, and we don't know that we're doing it because there's so many processes even in our general day-to-day going about our business. So what I'm going to introduce to you is our team and Team Hamilton Gordon. So you're going to get insight into the Hamilton Gordon household. So I've got 2 teenage boys and get teenagers in here. Yeah, I feel your pain, and they get pre-teens. Good luck. So what I'll say as a writer, first up, is that I'm really proud of these 2 fine young gentlemen. However, they are the terrorists, protagonists in our story that I'm about to go through. Now they say don't negotiate with terrorists back in the 80s and the 90s. These 2 are Jedi masters in negotiation, but I'll come back to that in a minute. So this is our team. This is Team Hamilton Gordon, and what we're trying to fix is probably a well-recognised problem. I see a few smiles in the room, probably online. The washing's on the floor. Not what we want to happen, especially when Elaine is a bit like Widow Twanky and gets quite perturbed if it's found on the floor. The ideal state that we want is that we've got sorted washing piles on the middle landing in order to achieve our aim in that on a daily basis, all the washing in the Hamilton household makes it to the washing machine. So that's our aim. So it's specific, all the washing. It's numeric because it's all the washing going in the washing machine, and it's on a daily basis. Okay, so you can actually see our aim, our primary driver, which is our main process, is that we want all the washing sorted in the middle landing. And what that requires is that the boys lift it off the floor and put it in the middle landing. You can see how this goes, can't you? So the plan, we've got the clear objective because we quite clearly said to them, we need the washing. We're making some predictions. Our change is going to be the verbal prompt, i.e. the nag, going to sort your washing in the middle landing. We think it's going to work because we've said to them on a daily basis, we've got the who, the when, the how and the where. So we've got the boys every day, the how they've got to lift it and put it in the landing, and where have they got to put it? In the landing. So we've got all that covered. However, you get these 2 involved. Do you think it's going to go as simple as that? There's some chuckles in the room. So when we did the test, this is what we found. So it wasn't on the floor, but it wasn't in the middle landing. It was in the washing baskets. Now this is where the Jedi Master negotiators come in. He told us to sort our washing, which is actually the phrase that we used. We said, sort your washing. So they took that as they put it in their washing baskets. So if we went back to our measurement and our aim, not all of the washing was in the washing machine on a daily basis. So actually we had 8 garments short. So that was our count. We were 8 short of what should have been a full house. Okay. So we captured feedbacks and observations to the boys. Well, you never told us that it was to go in the landing. And we're like, that's right. We didn't tell you that it was to go in the landing. So based on those observations, what we decided to do was analyse the data. We've still got washing. How did that compare to a prediction? We thought we were going to get it all. No, we didn't. What did we learn? We learned that we hadn't communicated properly with our team and we hadn't got a team bought into the process. So when we got into the ACT part of it, what were we going to do next? Well, we realised we're onto something because the washing was no longer on the floor. It was in the basket. However, that was adding an additional step in. The verbal prompt kind of worked because they did do it on the day that it was asked. However, what we're going to do, we're going to adapt our next test of change, and we're going to remove the washing baskets from the room in the hope that we are going to put it into the middle landing. So we've got our verbal prompt, because we're still going to continue to do that, because it's definitely not going to happen if you don't have the NAG. We're going to force the function to get them to put it into the middle landing. And so what we do is we're going to go back round the PDSA cycle again. What do you think happened? Do you think we were successful? I'll tell you why. We did get it for one day. Did we sustain our change? No, we didn't. And I'll tell you why. This is the master negotiators. So one says it's not in the middle landing because I come in at 3 o'clock in the morning because he's at second year at university. I was at Bamboo until 4 o'clock in the morning, and it wasn't really high up my priority list. And the other one said, oh, I just forgot, teenage boys, as they do. So still work to do in the household. What I would say is the addition to this is that there's now a new washing basket been added into the landing by Mrs H. I'm holding my breath to see how it works. So we did manage it for one day, but we hadn't sustained our change. But it just shows you that you think you've got it cracked. Sometimes it's worth just waiting a little bit longer just to see if you've sustained your change. It might be that you've got another PDSA cycle to go through. So don't just think, oh, we've got it cracked, hurrah. What you're looking to do is, can we consistently and reliably continue our process? So feed into practice. You've had hopefully a run through of what it's like in real life. Thinking back to that change idea that you picked earlier on that Megan asked you to do, what I'd like you to do, we've left I think we've got a blank template on the. Yes. We've got a blank PDSA template for you to fill out on as a team. So it's a team effort for those online. There's a link, and yeah, James just spoken a link to the virtual delegate bag. So please access the resources there. There's a Word version of the blank PDSA document. What we'd like you to do is discuss together one of your change ideas and just do the plan part of the PDSA. So that's going back to our fail to plan, plan to fail. And what I'd like you to do is just have a bash at filling out the plan part of it. You don't need to do the study and the act part of it. All we're looking for you to do is think about the who, the where, the when, the how, what's our aim, what are we trying to achieve, what's our theory, and what maybe could we measure in order to do that. And again, that relates back to the 3 questions relating to the PDSA cycle and how they're threaded through all of that. So we've got about 7 to 8 minutes just to, no, longer than that. How long have we got?
10 minutes.
10 minutes. 10 minutes to have a good chat around that. And what I'd like you to do is just complete the plan part of your blank PDSA cycle. And if you've got somebody that would like to feedback, how at the end of that, we'll ask you some questions at the end of that. Online audience, just we'll come back to you and you can just pop your reflections and doing that in the chat. If anybody's not clear, just pop it in the chat and we can explain it again. So 10 minutes, thinking back to the change that they picked earlier on. I just want you to take the blank template and work together to produce the plan part of it. Everybody all right with that?
Yeah, that is fine. Sorry, I was just looking at that. I think finish up that activity at 10 to, and then 5 minutes for the final messages, 5 minutes for the close. We finish it. 5 minutes before.
Cool.
Unmute them again, so they've not changed.
Is to pinpoint exactly what you're thinking and what you want to concentrate on. Would you think you just want to do this, and you realise you can't do it all?
I think you can't do. I think that's where your team's really important, and that you're bringing everybody involved in. You can't, and if you try to do too much, you don't know sometimes what the key thing that made the difference was. If you're trying 3 or 4 changes at once, I think you hit on it that well, which one had the biggest impact? And so unless you've got that stepped iterative rapid testing, you'll get there much quicker, but in a much more structured, logical fashion with clear learning and clear understanding that, okay, that change had low impact, however, that change got us nearly the whole hog. And it just helps that clarity of thought and that clarity of objective. That's great feedback. And at the back?
Yeah, I think it would be difficult. So it was an exam that I had, but I think it was just that way of the other day and taking it down, because I think sometimes it can be quite wide. And I sometimes just taking that down. So I think what I've done in the past is it is quite wide, and then get into that doing part, and then you don't know what you're measuring or still area. So I think just
Yeah, my own personal experience of my own quality improvement journey was I was terrified of the data. And now my colleagues in the room have a wry smile because I absolutely love the data because it tells your improvement story. It just gives you that instant recognition of that's working or we're not making any traction there because the data is telling us that we're not making any traction. So maybe we need to think a little bit differently and go back to a plan and a PDSA and think it out, is there another change or is there an adaptation to that PDSA that we need to make that might make the difference to get us to where we want our aim to be? Does that make sense? But I'll always tell you measurements so important, but without data, you're just a person with an opinion, as somebody famous once said in quality improvement terms. But for me, the data, it also helps sell your story at the end of it to others to get them bought in, because if the data speaks for itself. So not to go down a
and that continued measurement, because we did hear at this table really lovely baseline data, but then no collection of data.
Yes.
So that's hindsight's a wonderful thing, isn't it?
And they're not alone, that's what the systematic review say, that's what we do in PDSA. To get our baseline data and then we start like leave it.
Just from my point of view, because I have my background with project management in the private sector, and I think that it was what he's raised there around the whole planning stage. I think that you can't stress enough how important the planning aspect of any project, be it like if you're following PRIMS2 methodology or like the quality improvement methodology, is so important. I think your enthusiasm for making those changes and seeing the benefits of it, you need to kind of step back and actually say, yeah, the planning part is probably the most important part to any project.
So it's like if you're going on holiday and you don't plan how to get to the you're not getting there, are you? So I think that's.
I'm going to get a wee bit QI geeky, but there's a famous guy called Joseph Duran who talked about quality planning being a fundamental component of the whole shooting match, and it absolutely it's key, because you just start making assumptions, you go down rabbit holes, you shoot on offshoots that maybe aren't bringing you back to what you're trying to achieve in the first place. So it's a great shout. For those online, is there any comments? Did you find that easy or hard to do? Any reflections on your change about how you might look at it differently? Just waiting for the virtual delay that we have.
Katie, I think it is.
Thanks very much, Kate. I see your comments there. Celebrating Success Change, I'd be able to have some staff shout out board where staff could nominate each other and highlight each other's achievements. And as it's bringing that sense of team, which supports that improved culture and staff well-being, which, again, can't express enough. The relational aspect of quality improvement is so important, and your team is so important. Find your pals, and we highlighted that the group at the back. Plan also for Katie, predict that some staff will engage and some will not. Think about those staff who may not be nominated, need to be visible, and encourage staff to participate. So the worked example of the PDSA template that I've put on your desk that you can take away with you is actually a real one that I did in practice. And if you looked at the test, you could say it was a complete disaster. But actually, if you look at the learning that I got out of that test, it actually stood me in great stead for the testing going forward, because I'd made loads of assumptions, hadn't involved the team, hadn't communicated well enough, hadn't brought the people with me, and it just fell apart. So I had to really go back to the drawing board and think, right, okay, that didn't work, not because the concept itself wasn't right, but because my execution of it, and had I done the planning bit much better, because you can see my failure to plan and what I learned, and that's also available to those that are online as well. So we're short on time, so I'm just going to pass over to Claire just shortly. Just to recap, I'm not moving. Lost my cursor again.
Fine. Hello. No.
Thank you. So just to summarise, it's not just about one round the PDSA cycle, it's rapid testing. The quicker that you can do it, the more focused your team are, the more involved they get, the deeper in that they get, but also you can start small and then start to build it up and scale it. So you'll get that rapid impact to change. You'll get quickly through all your iterations of your PDSA cycles and hopefully get to changes that result in sustained improvement. So I'm now going to hand over to Claire just to close our session. So thanks very much for your participation.
Thanks, Scott and Megan, and I really enjoyed that actually because it goes back to basic principles, doesn't it? So I guess a wee bit of a take-home message for me is just find your people. So find your people who want to, be involved, who are enthusiastic. Don't worry about the people that are not. They'll come along afterwards. Start something. Do something really small. Measure it. Say at the beginning what's happening, but try not to overcomplicate it. But the most important thing is just go and do something. Think, what is that pebble in my shoe that I just want to go back and do? And if we can just make a small change, it will make a difference. So I guess that's my take-home message. Oh, did I go double there? No. Okay, we're going to go back to the Slido. You remember we asked at the beginning. So we're hopeful that you've got a bit out of the session today, and we're asking the same question. How confident would you be in trying a change using a PDSA cycle in your workplace? Great. So the message is go back and do one, isn't it? Go back, do one straight away, do it tomorrow, or if you're not if you're going back to work this afternoon, do it this afternoon. What's the one thing that you can do? Or if it's me, think about the thing, how I can control my pre-teenage and teenage children's washing. So I'll have a wee think about that when I go home, but it's not a washing basket in the hall, that's for sure. Okay, so we've got some post-it notes on the table, but we've also got the chat box. So what is one key message you'll take away from today's session? We'd really like to know that. What change are you planning to test when you go back into practice? And what could have made today's session even better? And we've got some flip charts in the room, but I'd be really, really pleased online if you could just put some of this into the chat box, because we're always wanting feedback and always wanting to make things a bit better. If you're attending the paediatric session, again, go and get some lunch now because it's at 1:30. If not, you just take a wee minute just to do that. We would be forever grateful. Keep these questions up for a little minute so that everybody can see them.
Sorry, I'm moving the tables now.
Well, they can't hear.
Exactly, yeah.
So a wee bit of feedback from online. Your plan is detailed and specific as possible, and the importance of spending time in the planning, and we've spoken about that already. So just thank you from us, and just a useful link to the materials that we've spoke about today, and I hope you enjoy the rest of your day and keep in touch with us. Thanks very much. We'll get some lunch.
See you on that, guys, on the website. Now you've got PDSAs.
Or have it.